How long do cat allergy symptoms last after exposure? Cat allergy symptoms can vary widely in duration depending on the individual, the severity of the allergy, and the extent of exposure. For most people, symptoms like sneezing, runny nose, itchy eyes, and skin irritation may last anywhere from a few hours to a few days after exposure to a cat. In more severe cases, symptoms can persist for weeks if allergens are not properly removed from the environment. Understanding cat allergies. Cat allergies are caused by a reaction to proteins found in a cat's saliva, skin, and urine. These proteins become airborne when a cat grooms itself, sheds dander, tiny flakes of skin, or uses the litter box. Even brief exposure to these allergens can trigger symptoms in sensitive individuals. Factors influencing symptom duration. Extent of exposure. Short-term contact: if you briefly visit a home with a cat or pet a cat and then leave, symptoms typically subside within a few hours to a day, provided you wash your hands and change clothes. Prolonged exposure. Spending extended periods in a cat's environment can lead to more persistent symptoms lasting several days, even after leaving the area. Allergen removal. Allergens can cling to clothing, furniture, and carpets. Without proper cleaning, lingering allergens can continue to trigger symptoms long after the cat is gone. Severity of allergy. Mild allergies may result in symptoms that dissipate within a few hours after exposure, while severe allergies can cause prolonged discomfort requiring medical intervention. Individual immune response. Some people have overactive immune systems that prolong symptoms as their bodies attempt to combat the perceived allergen threat. Managing and reducing symptoms. Immediate actions: wash hands and face. Rinse off any allergens that may be on your skin. Change clothes. Allergen particles can cling to fabric, so change into clean clothes as soon as possible. Use nasal sprays or antihistamines. Over-the-counter medications can alleviate symptoms quickly. Deep cleaning. If exposure occurred in your home, vacuum carpets, wash bedding, and use an air purifier to reduce allergens. Seek medical help for persistent symptoms. Consult a doctor who may prescribe stronger antihistamines, decongestants, or allergy shots. When symptoms persist. In rare cases, allergy symptoms may last for weeks if allergens are not adequately removed. This is especially common in environments where cats live full-time, as allergens accumulate in high concentrations. Conclusion. Cat allergy symptoms typically last anywhere from a few hours to a few days after exposure. The duration depends on factors such as the level of exposure, severity of the allergy, and steps taken to reduce allergens. To minimize symptoms, clean the affected area thoroughly and consider medical treatments for more severe reactions. If you experience prolonged or worsening symptoms, seek advice from a healthcare professional.